So how can we monitor intensity? So it's very important that we exercise at adequate intensities. And one of the most popular, frequently used ways of monitoring intensity is our heart rate. We choose to use heart rate because as exercise becomes more intense, our heart rate becomes more intense. What's really happening is that as exercise becomes more intense, the muscles are requiring oxygen at a faster rate. They require more oxygen to do the work at a higher intensity. So as a result, the heart needs to beat faster to get the oxygen to those working muscles. So as workload increase, heart rate and oxygen consumption increase. So there's where do we check our pulse? So remember I mentioned about how when the heart contracts, it sends out that bolus of blood, that almost like a wave of blood goes through the body. That's what we're feeling with with our pulse. There's like two really commonly used parts: the carotid pulse or the radial pulse. So the carotid pulse is on your carotid artery. The carotid artery is an artery in the neck. So it's under the jaw to the side of the throat. How I recommend you find this: if you take two fingers, your pointer and middle finger, put them at the corner of your eye, the outside corner of your eye, and then just drag your fingers straight down until they go over your jawline, and you end up nestled below the jaw into that little hollow. You'll easily find your carotid pulse there. Be careful you don't put much pressure when you take your carotid pulse. Um, Increase in pressure can affect your what we call baroreceptors, so blood pressure receptors just below that area. So very light pressure there. Okay. The other one is the radial pulse. So remember the radius. This is the pulse near the radius. The radius is on your forearm near your thumb. So usually what I do is I go from my thumb and I just work following my thumb angle until I reach my radius on the inside of my wrist. Okay. So it's proximal to the base of the thumb. So if you take where the root of the thumb attaches to the wrist, it's just up the arm from there. You want to make sure when you're taking pulse that you use very light pressure in both, and that you don't use your thumb, because your thumb has a more prominent artery in it that makes it confusing. So sometimes you'll count that artery pulse beat in your thumb. It gets confusing. So you use your first two fingers. So resting heart rate. How fast does your heart beat when you are resting, when you are not active? So average resting heart rate for males is approximately 72 beats per minute and 80 beats per minute for women. How high your resting heart rate will be dependent on things such as genetics. So some people will genetically have a higher resting heart rate. Current fitness level, as you're about to see, as you become more fit, your heart becomes more efficient, and your resting heart rate, your heart rate when you are not performing activity, will go down. Certain medications can elevate your heart rate, so especially stimulants, so caffeine, nicotine, those will elevate your heart rate. Environmental factors, so if you have changes in the heat and humidity, that could elevate the heart rate, as well as stress levels can also elevate heart rate. To really truly get an idea of what your resting heart rate is, you should really test it first thing in the morning before rising out of bed. So when you wake up, take a second, do a 10-15 second count, see what your heart rate's at. And ideally, you'll do this a few days in a row. So now, to start to get an idea of where we would, how we would create a prediction for how hard you should work, okay, when you're exercising, we need to understand what your maximal heart rate is. I make it clear, first of all, we don't exercise at our maximal heart rate, or we very, very rarely would exercise at our maximal heart rate. The maximal heart rate, your maximal heart rate, is as high as your heart can possibly beat. What's the fastest it can beat? This is done through the most extreme and heaviest of exercises. Now, the most accurate way to do this is through a graded test. They're usually graded treadmill tests. You would have a certified exercise physiologist or a certified personal trainer. They would test you. So this is when you run, this is doing like a VO2 max test, okay? Ultimate high intensity. And you would go until you could not physically go any harder, and that number would be your maximal heart rate. If you know your maximal heart rate, you don't calculate it as per your age predicted one. So most people don't have their maximal heart rate. Most people have not done a graded test. So what we have done is we have created we, meaning the fitness world, has created a way to predict what your maximal heart rate might be. So this equation that they will use is 220 minus your age. 220 minus your age. So if you are 20 years old, we will predict that the maximal level that your heart rate will go to will be 220 minus your age, which is 20. So your maximal heart rate is 200 beats per minute. This is a prediction. It is an estimate. It's quite often actually not accurate. There's a lot of problems with that equation, but it gives us a starting point. Now, using that equation, that will also show us that maximal heart rate will naturally decline with age. So even if you have done a maximal heart rate test, and so you've done a graded exercise test, after a few years, that information is no longer applicable because it will naturally decrease with age. Okay, so once again, to figure out your predicted maximal heart rate, it's 220 minus your age. Now, it's important to note, we don't exercise at that. So if that 20-year-old, I don't tell them, okay, go do exercises at 200 beats per minute. Okay, that's much too high. Much too high. That's an exercise intensity that you could only maintain for an extremely short time. So what we'll actually calculate for them is a target heart rate zone. And there are going to be recommendations of what that target heart rate zone should be. And in fact, we will work our way through. And in your textbook is a chart that will tell you what moderate to vigorous activity is and what percentage of their age predicted maximal heart rate they should work at. So what you would do is you would take 220 minus your age and you would multiply it by the percentage at which you wanted to exercise. So let's take our 20-year-old again. So it's 220 minus their age, which is 20, gives them a maximal heart rate of 200 beats per minute. If I told you I want that individual exercising at 60% of their maximal heart rate, and I'll know that I want it 60% because I will follow guidelines and recommendations, which you'll see shortly. So if I want them to work at 60% of the maximal heart rate, I would times 200 by 60, which would give me 120 beats per minute. That would be their exercise heart rate. That is where I want them to exercise. Okay? If I wanted them to exercise at 70%, I would times 200, their age predicted maximal heart rate, by 70 to get 140 beats per minute. I could then further divide those numbers by divide those numbers by 6 to get a 10-second count. So if the individual doesn't have a heart rate monitor, I would take 120, which is 60% of their max heart rate, and I would come up with 20 beats in 10 seconds because that's a quick way that they could check their pulse. So here we have it again. So target heart rate, you do 220 minus your age equals your age predicted maximal heart rate. Remember, this is not the level at which we exercise. We then take that age predicted maximal heart rate and we figure out what percentage of intensity we want them working at. So a lower limit's often 60%. An upper limit can be upwards of 90%. So if I want to do 90%, I would take 200 multiplied by 90%, which would give me 180 beats per minute. So if I wanted them to work in the range between 60 to 90%, which is a very large range, but I would tell them, I want you to be exercising between 120 beats per minute to 180 beats per minute. We don't normally give that large of a range, but that's how we would do it. And then if I wanted to get a 10-second count, I would divide it by 6. So that's why back in the day when you used to see those charts on the gym walls that would say, oh, at age 20, at a lower intensity, you want 20 beats per 10 seconds. At high intensity, you want 30 beats per 10 seconds. They just did this math in advance for us. So the age predicted maximal heart rate equate. Oh, and sorry, I should mention too, if you already know your maximal heart rate, so if you did a graded test, you don't use the age predicted number, you use your graded test number that gives you your true maximal heart rate, and then you would still multiply it by the percentages to figure out what intensity you want. So this method, if you're using age predicted, is very inaccurate. There's a lot of potential issues with it. So in an attempt to make things more personalized and more accurate, we came up, or Dr. Carvonin came up with a method called the heart rate reserve. So you'll hear this called the Carvonin method. This tries to individualize things a little bit by using not just your age predicted maximal heart rate, but also your own personal resting heart rate. And he says that your heart rate reserve is the difference between your maximal heart rate and your resting heart rate. So this is going to give us, we're going to use this formula to come up with different targets. Okay, so you will, once again, we can determine that we want to be working at 60% of our heart rate reserve, right? So we will know what percentage we want. So you use your age predicted maximal heart rate and your resting heart rate. So the heart rate reserve, HRR, is maximal heart rate minus resting heart rate. So his formula, you will determine in advance what intensity you want the individual working at, and you will multiply that by their heart rate reserve, which is their maximal heart rate minus their resting heart rate. When you have that number, you add back in your resting heart rate. Don't panic. We're going to go through an example. And truthfully, when I calculate this number for clients, I just usually have a formula in front of me so I don't trip over things. So going into this equation, we would not need to know your maximal heart rate as well as have tested your resting heart rate. So let's take the example. Okay, we're going to figure out their heart rate range, and this is going to be for an individual that's 32 years old who has a resting heart rate of 80 beats per minute. They have told us, and once again, you'll see shortly the charts that will show you where you want individuals to exercise at. But there, for this example, are telling us that we want to give this lady a range in which to exercise, and we're going to say the lower intensity will be 50% of our heart rate reserve, and the upper limit will be 75% of her heart rate reserve. So to do this, we're going to need some information going into it. We'll need to know what her age predicted maximal heart rate is. So we know that's going to be 220 minus her age, which is 32 years old, which gives us 188 beats per minute. That's her age predicted maximal heart rate. She does not exercise at this because this is the level where her heart couldn't go any faster. We have been told that we have her resting heart rate of 80 beats per minute. And now we're going to figure out their desired percentage intensity. So we do percentage of intensity multiplied by your heart rate reserve. Once you have that number, you add back in your resting heart rate. It's very important that you do that first step before adding back in that resting heart rate. This is where people go wrong. So you do percentage intensity. We've said that's going to be 50% multiplied by your heart rate reserve. So in her case, that's 188 minus 80, and then you add back in 80. So when you're looking at that equation, you want to do 188 minus 80 to give you 108. You are going to multiply that by 50%. You'll take that 50, so that should give you 54, and you will add 54 to 80 to give you the number of 134 beats per minute. It is extremely important that you do this in order, because if you try to add things in too soon, you get odd numbers. Okay? And you could do that exact same thing now at 75%. So this is going to give her 161 beats per minute, and there you have your answer. So I would say to my client, I want you exercising between 50 and 75% of your heart rate reserve. So when you're doing your cardiovascular exercise, I want your heart rate to be between 134 to 161 beats per minute. Or we can do a 10-second count. So I would simply take those numbers and divide them by 6, because there's 60 seconds in a minute, which will give me a 10-second count, which would give her 22 to 27 beats. You need to calculate this before activity. So they would go in. So usually if I was consulting with personal training, I would calculate this. They'd be sitting down, I'd get their resting heart rate, I would do these calculations, and I would give them the number and say, exercise in this range. And I encourage you right now, I would honestly pause the recording, and I would calculate this yourself. Okay? Our heart rates will naturally decline with age, so if you are a lot older than 32, odds are quite strong that you will end up with a target heart rate of a lower number. If you're younger than 32, the odds are quite strong that you'll end up with a number, exercise heart rate higher than what this individual has. There is a little bit of a difference in there because resting heart rate's taken into account, but for the most part, that'll be a trend because our maximal heart rate naturally declines with age. So I'm going to differ a little bit about this. Here they're saying it's challenging to calculate heart rate in a group class setting. Although it's easy to check pulse, to do the calculations are hard. That said, if an individual goes, so I agree, I will concur that if I went to an exercise class and in the middle of the class I had the individuals calculate what their target heart rate should be, that wouldn't work at all. However, if an individual goes into an exercise class already knowing what their target heart rate zone is, they could quickly do a 10-second count to confirm that they're in the range that they want to be. So in that last example, I think her 10-second count ended up being 22 to 27. So if all of a sudden in that 10-second count, her heart rate's up closer to 30, well, we would tell her she needs to ease things up. Or else if during that 10-second count, her heart rate is down at 18, well, we tell her she'd have to work a little harder. Okay? They do mention very correctly that heart rate is not a perfect measurement, especially when you need to use the age predicted equation, the 220. So both Carvonin and your maximal heart rate percentage, both of them, if they use age predicted maximal heart rate, there is a great range of error in this. It is very common for people to have a true maximal heart rate that's 10 beats per minute faster or slower than what the age predicted formula. So this is not perfect. Heart rate is not perfect, and plus we've already talked about it. It can be affected by stimulants or relaxants. It can be affected by different things. So it's best to have an arsenal of different ways to check. So it's not like we can't use heart rate, but let's check other things as well, which we're about to discuss. So the rate of perceived exertion. Now, originally, this was called the Borg Scale. You should be familiar with that term, the Borg Scale. The Borg Scale, Gunnar Borg created, and he used a scale that made the most, and you don't have a picture of this. This is the modified scale you have in front of you. So the Borg scale went from 6 being very light intensity to 200 being max effort. 6 to 20, pardon me, 6 to 20. He created the scale going from 6 to 20 on purpose because he found that it corresponded with actual heart rates. So that if you were at level 6 of very light intensity, odds are you were working around 60 beats per minute. And if you were all out maximal effort, odds are you were working around, if you were at 20, you were really at 200 beats per minute. That's why he created it. So the Borg scale is a rate of perceived exertion. It's a scale, and it went from 6 to 20. Okay, and it corresponded with actual heart rates. The downside was it was a little bit confusing. So people found that hard to go, well, 6, like I'm a 14 from 6 to 20. They found it a confusing scale. So then we modified it just to what we call our rate of perceived exertion, where we changed it from a 1 to 10. So it no longer corresponds with heart rates at all, but it's an easier scale to use. Because if you are exercising, and I said on a scale of 1 to 10, how hard are you working? It's probably pretty easy for you to come up with a number. So, as I said, Borg's research demonstrated that rate of perceived exertion scale that he had from 6 to 20 corresponded with heart rate, which also matched up with ventilation rate or ventilatory rate, oxygen consumption rate, etc. However, it was kind of confusing. So people were confused by it. So unless they had all the descriptive words to read, to simply call out a number was very hard for them. So they created a 1 to 10 scale instead. So there it is. So if I tell you I want you, remember, we keep talking about moderate to vigorous activity, right? That's what we want to get at. So I would want individuals exercising, if they're a beginner, at moderate activity level. So I'd want them out of 4 to 6 out of 10 for the rate of perceived exertion. So they would describe that as feels like they get exercise for hours and they're breathing heavily, but they can hold short conversations. Once they become more advanced, I would tell them they'd want to be at a vigorous intensity. So I would say a 7 to 8 out of 10. So on the verge of becoming uncomfortable, they're short of breath, but can still speak a short sentence. So that's how we use this chart. Couple pointers about this chart. It can actually be very, very accurate with practice. But initially, untrained women, especially women, will tend to rate their activity level higher than it actually is. So perhaps they're working vigorously and they might consider that to be very hard or almost max. So women, especially untrained women, tend to over predict how hard they're working, whereas men, especially untrained, well, not necessarily untrained men, but men and athletes will under predict. So they'll think they're going moderate when in truth they're working vigorous. So be aware of these. You could still absolutely use these scores, but this is where I use other things. So I might have a female that says that, oh, I'm working at very hard activity, and then I check her heart rate. And even though heart rate's not perfect, but her heart rate's really low, and she's able to pretty much have a conversation with me, well, I would know she wasn't working as hard as she perceived her. So, educate her on how to use the scale. And with practice, this becomes a very accurate system. Talk test is another way. And this is as intensity increases, our ability to speak decreases. So during activity, participants should be able to breathe comfortably and carry on a short word sentences conversation. So if you have an individual that's exercising and they can't gasp out a single word, if they can't say anything, then it's going to be an indicator to you that they are working too intensely, that they need to dial back that intensity. So once again, if they're gasping or demonstrating signs of shortness of breath, they should reduce their exercise. So this encourages your participants to talk during the workout, well, more interact with them. So I will have an individual exercising on the treadmill, and I'll start to ask them questions. And if I ask them a question and they are just telling me a long story and they're going smoothly and they're not having any problem, it's going to indicate to me that they're not working very hard. So I'll have to increase that intensity. Or if I ask them a question and they could barely blurt out the answer, then I need to dial things back. It sounds like an overly simplified system. It actually is a very effective way. It deals with that ventilatory threshold. So as intensities go up, our demand for oxygen at the working muscles go up, and therefore we need to start breathing much more rapidly. If we have to breathe rapidly, it's hard for us to hold a conversation. So this is a really great tool. And I like how it says at the beginning it should be used in addition to the heart rate or rate of perceived exertion. Use a combination. Check where the heart rate is. Make sure that's making sense. And check to where their rate of perceived exertion are. So like I said, if the individual is able to have a full conversation like I am, but they call themselves 9 out of 10 on the intensity scale, I would know that perhaps their understanding of the scale might not be correct. So I would know that if they could have a full conversation, that they're probably more like a 4 out of 10. So this is a chart I kept telling you about, okay? At first glance, it's overwhelming. There's a lot of numbers, a lot of words going on. But I'm going to encourage you and remind you that we are told that we want to be exercising at moderate to vigorous intensity. So forget the very light row, forget the light row, forget the very hard or maximal. Look at moderate to vigorous. And what it's going to do is it's going to give you different ways of monitoring things. You will notice that if you are using the Carvonen method, the recommended percentages with the Carvonen method are lower percentages than if you're just using age-predicted maximal heart rate. So if you were to calculate those both out, so noticing that heart rate reserve is lower than maximal heart rate percentages, they will actually still give you an N number that's pretty close. So maybe they both, by the time you plug those numbers and those percentages into the equation, they'll both come up with, say, 120 beats per minute or approximately. Okay, so they are different. And all you do in prescribing intensities, if you have a beginner, you would calculate for them. You'd look at this chart and go, okay, a beginner, I want to keep them lower intensity. They haven't trained for a long time. I'm going to recommend they work between 40 and 50% of their heart rate reserve. And I will calculate what 40% of their heart rate reserve is. I will calculate 50% of their heart rate reserve. and I will tell them that I want them to work in that range, what those numbers end up being. As they become more advanced, I'm going to take their intensity up. So then I might say, okay, you know what? You're now a fit individual. I want you to do a short workout twice a week in addition to what you're already doing, but we're going to take you for cardiovascular intensity. We're going to take it up. And now, let's say this time we're using percentage of heart rate max. I will do 220 minus their age, and maybe I'll tell them I want you between 80 and 90% of your age predicted maximal heart rate. And so I will calculate what 80% is, I will calculate what 90% is, and I will give them an answer. So you use this chart to know what the percentage range should be, and then you take the information from the participant to calculate what the actual numbers are. The other things that this will show is that if you're using the Borg scale at moderate intensities, you should be about a 12 to 13. On the rate of perceived exertion scale, that would be 4 to 6. If you're going vigorous activity, it would be 14 to 16 on the Borg scale. Rate of perceived exertion, 7 to 8. The talk test, so the breathing rate, moderate would be short sentences. So they can get out a short sentence, but they're not having, it's not the same thing as light where they're talking easily. Vigorous, now they're only getting out a few words at a time. They could still talk, but they can only get a few words. Okay, and then they give you an idea, even though it's not accurate, you don't use stuff like sweating or body temperature to determine whether it's moderate or vigorous. Those are inaccurate ways, but just in general, they're just telling you that the body's going to feel warm during moderate or very warm during vigorous. That most people, moderate might be a brisk walk, whereas vigorous would be jogging. Okay, so this is how you use a scale. Don't get overwhelmed by this. Keep this handy. This is a very powerful tool in prescribing intensities, because otherwise if somebody comes in and says, how hard should I be working? Well, what are you going to tell them? How are you going to decide what percentage of intensity? The scale will tell you. So let's change gears a little bit. Let's talk a little bit about blood pressure, because blood pressure is a big concern. So blood pressure is actually the pressure of the blood against the inner walls of the blood vessels. So how hard the blood is pushing against the blood vessels. Your blood pressure will actually be different in different parts of your body. It's different, and we know this, during different phases of the heart contraction. So while the heart is contracting or beating, the blood pressure will be higher than when the heart is resting or in between beats, and it's lower. And we'll discuss that in just one moment. Also, under different environmental conditions and health conditions, your blood pressure can be affected. We measure your blood pressure cup using blood pressure using a blood pressure cup. So during contractions of your heart, which is called systole, so when that left ventricle is contracting to send blood out into the body, we call that systole. Blood is going to be pumped out into the arterial system, which greatly increases the volume. So you get that wave of blood coming through. So this results in an increase in pressure, and it's also the highest pressure that it will be experienced through the cycle of the heart. So this is your systolic blood pressure. The systolic blood pressure is the pressure in the vessels when the heart is beating. So it will be a higher number. During relaxation of the heart, which is called diastole, so that's when the heart is not contracting, so in between beats, this will be the lowest pressure because the heart's filling up. Okay, so the heart's filling up, the pressure in the body will be at the lowest, and this is called your diastolic blood pressure. So when you see blood pressure numbers, you see it's something over something. So 120 over 80, 120 is the amount of pressure that's occurring of millimeters of mercury, 120 is the highest blood pressure, and that's during the systolic blood pressure while the heart is contracting. The lower number, in my example, is 80, is going to be 80 millimeters of mercury, and that is going to be the lowest blood pressure because the heart is relaxing, it's in between beats, and blood is filling back up into the heart. So here are these ranges. So systolic over diastolic. It is outside of your scope of practice to be testing blood pressures, but you should understand the concept of blood pressure. So really, nowadays, we really don't want people going much above 120 over 80 beats per minute. So we prefer people to be lower. Once you get higher, risks occur. And the reason is that if your blood pressure is very high, that means your heart has to beat very hard and has to work very hard to push blood out into a system that already has a high pressure. So normal blood pressure, just in your mind, think 120 over 80 or lower. Okay, so systolic blood pressure when the heart's contracting is 120 millimeters of mercury. When the heart is relaxing, it's 80 millimeters of mercury. People will have them lower. They vary from individuals, and they're affected by age. It naturally increases usually as we age. By our body position, it changes with the amount of exercise we do, with our weight, with stress, etc. So hypertension is high blood pressure. Hypertension is high blood pressure, and we call this a silent killer because what happens is you don't know that you have high blood pressure. You don't feel anything when your blood pressure is high. You feel normal because you adapt to it slowly and gradually. And so that means if your blood pressure is very high, your heart has to work very, very hard. Your heart is a muscle, and after a while, it causes degenerative changes in your heart and your blood vessels. So unless you're getting your blood pressure checked, you don't know you have this. So how does our blood pressure respond to exercise? So you should know all of these different stages, okay? During exercise, while you are exercising, your systolic blood pressure, so as your heart's beating, will actually increase as intensity rises. Okay, so this is the rise in systolic pressure is a result of the heart trying to pump more blood to the working muscles. Okay, so your blood pressure will be higher. Your muscles are contracting. It's causing a resistance against the blood flow. Systolic blood pressure rises while exercising. Your diastolic blood pressure will actually remain close to the same. Okay, so your diastolic blood pressure. So in fact, when we're doing graded exercise tests, that's how it indicates to us something might not be going right, is that we'd see changes in your diastolic blood pressure, which we don't expect to see. So if asked, during exercise, while you're physically exercising, your systolic blood pressure will go up, your diastolic blood pressure will remain unchanged. After you finish your bout of exercise, within a few minutes, your blood pressure should return back to your normal values. Now, what's important to know is that regularly performed exercise, cardiovascular exercise, will result in a decrease in your resting blood pressure. So your everyday blood pressure will start to go down as a result of exercise. So in as early as 3 to 4 weeks after exercising, starting an exercise program, we'll actually find that your resting values are lower. So once again, during exercise, acute bout of exercise, while it's happening, systolic goes up, diastolic stays the same. Within minutes after exercising, they return to your normal values, and that over time, exercise programs will result in lower systolic and diastolic blood pressures, which is a very good thing. It means that the heart does not have to pump as hard. So a very important concept to understand is cardiac output. So cardiac output is the amount of blood that the heart will pump per minute. It is the product of your heart rate and your stroke volume. So how much blood your body will circulate per minute is a product of your heart rate, how fast your heart's beating, and your stroke volume, how much blood is sent out with every single beat. When we are deconditioned, when we're not trained very well, our stroke volume, so the amount of blood sent out with each beat, is low. It's not a very efficient, and that's at rest or at exercise. So I could be sitting here right now, and if I do not do cardiovascular exercise, my stroke volume will be lower. My heart is not going to be as efficient at pumping blood around the body. As a result, because I do not send out as much blood with each heartbeat, my heart rate has to be higher. Okay, so if I'm not sending as much blood out with each beat, my heart rate needs to be higher to get that blood to circulate around my body. Picture this like a bicycle pump, a bicycle tire pump. Okay, you could either do a large stroke volume, which would be a really large pump with each pump. Okay, you could do a large stroke volume and not do as many pumps or heartbeats to fill up that bike tire. Or you can move less effectively and do a bunch of little tiny pumps, so rapidly pumping very, very quickly, but you're not going through that full stroke volume. As a result, you have to do way more pumps. Okay, that's what your heart will do. It's going to send the same amount of blood around your system regardless, right? So how much blood gets sent around stays the same. But if you don't have an effective system, your stroke volume will be low, therefore your heart rate needs to increase. What happens when we exercise and start cardiovascular exercise is our heart becomes more efficient. It fills with more blood, and with each beat of the heart, our stroke volume increases, and it will send more blood around the body with each beat. As a result, our heart rate will be lower, because now you do not require as many beats of the heart to get oxygen around the body, because the system is more efficient. This is why our heart rate decreases with exercise. So our resting heart rate will decrease with exercise. Now, our maximal cardiac output the amount of cardiac output we can generate per minute will decline with age. When we exercise, so when I start an exercise, so I'm sitting here right now, my cardiac output, the amount of blood that I'm circulating, is at a certain amount, okay? If I get up and start exercising, my cardiac output will increase. So the demands of blood getting to my working muscles will increase, and it'll increase both as a result of a higher stroke volume. So my stroke volume will increase, but then my heart rate will still increase to send blood around my body, because my cardiac output, the needs for the blood around the body, are increasing. So we'll look at this a little bit more. So our cardiac output during exercise increases because we'll elevate how fast our heart beats to get blood to the working muscles. Our stroke volume will also increase while exercising. So really it's a combination of both of them.